Hi, my name is Macy Bodo, and this is my presentation on nursing assessment tools. In this presentation, I will be talking about three different nursing assessment tools. Let me move myself here so that way I am out of the way. I will be talking about the PQRST Pain Scale Assessment Tool, the Glasgow Coma Scale, and the Morse-Fall Scoring Assessment. These are all very important tools, and I specifically picked them because I feel like they are used frequently as well as they are really important. The scale is a tool that is used every single day, multiple times a day, by nurses to assess their patient's pain and utilized to decide what interventions are necessary to manage their pain. The Glasgow Coma Scale allows nurses to assess a patient's level of consciousness and can be really important in the trauma setting for initiating interventions. And then lastly, the Morse-Fall scoring scale is also used every day by nurses to assess the risk of their patient falling, in which taking fall prevention measures is very important to protect the patient. So the PQRST pain assessment tool is the first one I'll be talking about, and this is utilized to help nurses describe, assess, and document a patient's pain in order to provide appropriate interventions to help alleviate their pain. So I included a little graphic here that explains the different letters and what they mean. P stands for provoking factors. So this is what you would ask the patient, like what factors are precipitating or causing their pain. Q stands for quality. So you're going to ask them to describe their pain, discomfort, and its characteristics. So you could ask them, is it achy? Is it dull? Is it sharp? Next is R, which is region and radiation. So where is the pain and does it radiate anywhere? Next is severity, and this is where you would ask the patient to rate their pain on a pain scale. And then T is for time. So how long has the patient had the pain, and does anything make it worse or better? The targeted population for this tool would be any patient who is in the hospital or care setting and experiencing pain. The nurse can utilize this tool to get a good understanding of what the patient's pain is and therefore can effectively provide interventions to manage that pain. Again, this would be utilized in the hospital or any care setting where a patient is experiencing pain and where the nurse needs a better understanding of their patient's pain. This tool is currently utilized at my place of work, Altman Hospital. I am a patient care technician and I listen to nurses assess their patient's pain using this tool very frequently. It helps the nurse gauge what their patient is truly feeling and therefore helps them decide what interventions are best fit to manage that patient's pain. I have also personally utilized this tool as a nursing student to recognize my patient's pain, and I feel it is very effective and it helps me gain a better understanding of what they're feeling. So some data about this pain assessment tool. In a research article titled Practice and Reflection on the Management Mode of Pain Quality Control and Emergency Pre-Check and Triage, the PQRST tool was utilized to standardize the assessment of pain and triage in the emergency room. When they utilized this tool, the results of the pain tool were used to then help determine their level of triage and type of care to be utilized for that patient. The results of this study showed that with the utilization of this pain tool, pain management target rates were met and there was an improvement in the management of triage pain. This research article is a good example of the validity of the tool. It shows it improves pain management rates as well as the fact that it is effectively utilized. It is also a good example of local data about the tool and how it is used. I did not find any state or national data regarding this tool, but given that it is used effectively in this study, as well as at my place of work, I would say it is an effective and valuable tool. So, some strengths and weaknesses of the PQ-RST tool. Strengths, it allows the nurse to get a deep assessment of the patient's pain and not a superficial assessment. And it also helps guide appropriate interventions for pain management. Weakness, the patient has to be able to provide accurate answers to the questions that are asked within the tool. So I gave an example here. If the patient was not completely oriented and they might be, slightly confused, their answers might not be accurate. My personal assessment of the tool is that it is very useful. As mentioned previously, I have utilized this assessment in my own nursing practice as a student, I feel as though it really helps me understand my patient's pain and gives me more information to be able to provide pain management interventions for the patient. I do, however, think a downside of it is that many patients, again, do not give accurate or descriptive answers to the questions asked in the assessment, and therefore it does not give you as much information if they don't comply. If I had to redo part of the tool, I would have a specific pain scale dedicated for the severity section so that the tool is more standardized. So, first question here, which of the following is not a part of the pain assessment tool? Severity, quality, provoking factors, or education? The answer here is education. Although educating your patient about their pain and pain management techniques is important, it is not a part of the assessment scale. So the next tool here is the Glasgow Coma Scale. The Glasgow Coma Scale is a tool used to describe the extent of impaired consciousness in all types of acute medical and trauma patients. The scale assesses according to three aspects of responsiveness: eyes, motor, and verbal. The scale uses a scoring system for each category. For example, if the patient's eyes open spontaneously, they get a score of 4. If they open to verbal command or speech, they get a score of 3. If their eyes open to pain, they get a score of 2. And if they do not open their eyes at all, they get a 1. Each of the three categories gets a score, and then they are added up for a final score. The patient can have a final score between 3 and 15. Scores between 13 to 15 indicate mild injury. Scores between 9 to 12 indicate moderate injury, and anything 8 or less is severe and needs immediate treatment. This tool would be utilized in a hospital setting. For example, if a patient came into the emergency room with a head injury, the Glasgow Coma Scale would be used and then would be used again and again to continually assess the patient throughout their stay. The targeted population would be patients who are in the acute medical setting and trauma patients who are already at risk for head injury or any sort of impaired consciousness, or who are already experiencing impaired consciousness. As stated previously, I am a patient care tech at Altman Hospital and I work on the cardiovascular ICU. Typically, this tool is not utilized in my care setting, but I have seen it utilized in other parts of the hospital during my clinical rotations. For example, when I was in the emergency room, we had a young male come in from a motor vehicle accident, and the nurse utilized the Glasgow Coma Scale upon his arrival to assess his level of consciousness. So, some data about the Glasgow Coma Scale. It became widespread starting in the 1980s when the Advanced Trauma and Life Support recommended for its use in all patients. The World Federation of Neurosurgical Societies used it in its scale for grading patients with subarachnoid hemorrhage. The scale and its total score have been incorporated in numerous clinical guidelines and scoring systems for victims of trauma or critical illness. It is a required component of the National Institute of Health Common Data Elements for studies of head injury, and then it is used in more than 75 countries. It's clear from this that state and national data that the Glasgow Coma Scale is reliable, and it is a valid assessment tool that can be utilized for patients in the acute trauma setting, especially due to the fact that it is incorporated in large corporations such as the National Institute of Health and used in several countries. So some strengths and weaknesses to the Glasgow Coma Scale. Strengths, the scale can be utilized on any patient, whether they are able to respond or not, given that it assesses their level of consciousness. Weaknesses, although the scale is objective, there is room for error when the assessor is determining the score for their patient based on their knowledge and experience. My personal assessment of the tool is that it is very useful and reliable. I think that the tool assesses the very important parts of the body and response system that are needed when it comes to determining someone's level of consciousness. One thing I do not like about it is that it's not something that is easy memorizable as far as the scoring system goes. I really don't know what I would change, given that I have not actually got the opportunity to utilize this scale myself and see what worked and didn't work. But if there was a way to, though, I would make the scale, like the scoring system, more easily memorizable. So a true false question here. The lower the Glasgow Coma Scale score, the more oriented the patient is. And the answer to that is false. It's actually the higher the score, the more oriented the patient is. The lower the score, the more serious their condition and lack of orientation is. So, the last tool that I will be talking about is the Morse Fall Scale. This tool can be utilized to identify risk factors for falls in hospitalized patients. The total score may be used to predict future falls, but it is also used to identify risk factors using the scale and then plan of care to address those risk factors. The targeted population for this tool is any patient in a care setting, whether that be acute care, long-term care, outpatient, etc. This would also be the places that this tool would be implemented. Um, Nurses in these settings will utilize this tool to help determine what their patients' risk factors are for falls and how much their patients are at risk for falls. This tool is utilized all throughout Altman Hospital where I work. It is important that we assess the things that may be putting our patients at risk for falls so that we can help prevent them from happening. We utilize this on every single patient that comes to our floor, and it is reassessed daily. So some data about the Morse Fall Scale. The Morse Fall Scale is used widely in acute care settings, both in the hospital and long-term care and patient settings across the United States. 82.9% of nurses rate the scale as quick and easy to use. And then in a research study done utilizing the Morse Fall scale, it indicated that a higher percentage of patients who fell were classified in the category high risk for falls in the Morse Fall scale. Being that the Morse Fall scale showed in the study that the patients who were classified as high risk were in the percentage of patients who fell, show that the scale is valid in assessing the risk of a patient falling and that it is a reliable scale. There's not a lot of posted national or state data regarding the Morse scale, but being that it is so widely used shows that it is a key assessment tool. So strengths and weaknesses. Strengths, it gives nurses a way to consider multiple aspects of the patient environment and how it might increase their risk for falls. It also gives them a way to predict and prevent falls, which is just really important. Weaknesses, just because someone has a low Morse fall scale does not mean that they do not have a risk for falling. Some might see a low fall risk score and not take measures to prevent falls even if they are needed. So a good example here would be like if a patient was independent, so they might have a lower Morse fall score, but they might have things in their room that aren't maybe on the score, or they just don't take into consideration and they could still fall. My personal assessment of this tool is that it's very useful. Immediately when I notice that one of my patients has a high Morse fall score, I check to make sure they have yellow socks, a fall ID band on, and a yellow star on their doors so that people are aware my patient is at risk for falls and prevention measures are therefore taken. I really do not see many negative aspects to this tool. I think it is very beneficial assessment technique. The one thing I would redo about this scoring is making the scoring numbers smaller and easier and quicker to add. For example, if they utilize the scoring with numbers such as 1, 2, 3, and 4 instead of using the numbers 15, 20, 25, and 30, it'd be easier to add. Okay. So a little summary / relation to health promotion. Our textbook defines health promotion as allowing people to know about and take control of their health, but also recognizing that behavioral determinants and social and physical environment determinants affect our health behaviors as well. These 3 tools are useful in promoting health because they allow you to take steps before poor health choices are made. The PQRST pain tool allows accurate interventions to be made to manage pain, which is a part of the patient's health. The Glasgow Coma Scale allows accurate interventions to be made based upon their level of consciousness, and the Morse Fall promotes health through the prevention and risk assessment of falls. So these are questions that, since I'm doing a recorded PowerPoint, that I think might get asked if I was doing it to a live audience. So the first one is, what assessment tool do you feel is the most widely / important in healthcare? I feel the most utilized and important is the Morse fall scale. Falls can lead to further injury and longer hospital stays, so this scale helps healthcare staff recognize when a patient is at risk for falls, and it indicates exactly what is putting the patient at risk for it, so interventions can be done to prevent it. I just think it's really important in protecting the health of the patient. And then the second question is, which assessment tool is the hardest to learn and utilize? I feel like this is the Glasgow Coma Scale. For example, I think it could be hard for a new nurse to determine whether a patient, like, say, opens their eyes after you spoke or if they just spontaneously did. I think it just takes a bit of practice to be accurate with it. Here are some of my references, or all of my references, and then my student badge. And that's the end of my presentation.